stay with us. Dr. Talk from Pacific International Hospital. He will talk about your ears, your nose, and your throat. Stay tuned.
Hi, I'm Dr. Ronny Koli. I'm talking to you from Pacific International Hospital. Just at the background of the main emergency department, as you can see, there's a nice geography, there's a nice cool breeze coming down, there's a flow, a bit of a rain down here, a very nice weather. I'm going to be talking to you today regarding the common infections that affect the ENT, or the ear, nose and throat. Well, let's just carry on and I'll explain to you as I go further. So we're going to go into the hospital and I'm going to show you what we do in here in our emergency department. All right? I am now going to talk to you or show you the structures that are involved in the conditions that affect the ear, nose and throat. If you can see up on the screen here, you can see that here's an ear there, you got a nose and then the throat. See, this is the normal structure of the hearing. How does ear perceive sound and the normal mechanism of the hearing. So any of these structures get affected, that's give rise to the problem in hearing. Now this structure or the diagram represents the link between the hearing and the nose, as well as the throat as well, you can see. So any pathology or any infections that affect the hearing system can also affect the nose, and they can also track down to cause throat infection as well. This diagram represents how sound can damage the hearing. Heavy sound or loud sound, as you can see, is demonstrated with a headphone there. Loud noise, what happens is damage the eardrum. In adults, not only adults, you'd not be surprised if some of the children do chew boy, or we call it in PNG, a betel nut. Betel nut is not good for the throat problems. It gives rise to mouth cancers and throat cancers. What that leaks or that comes together hand in hand with betel nut chewing is smoking. So I basically want to talk to the people regarding the effects that smoking and betel nut has on the general health. It is not an uncommon thing that we see in children that come with choking, most often associated with foreign bodies. Most foreign bodies that we see are the toys that are left lying around at home. And when the children get unattended to, they tend to put the foreign body into their mouth and they chew on it, they suck on it, and accidentally what happens, they get into the airway and it blocks their airway and they start difficulty in breathing. And the simple measures that we need to educate the community is how to get it done at home. If you see it up here on the diagram, the simple measures how you do it. You get your child hub and just follow exactly what it shows on the picture. So you give a back blow on the back. So what you're doing, you're applying a pressure inside into abdominal pressure so that it can cough it out or you can spit it out. The foreign body can just come out because it is totally a preventable thing, but it can kill the person. Foreign bodies in the throat as well is another common thing that we get to see. And most of the things that we see in our settings are fish bone. And there have been instances of chicken bone and steak bone get stuck in your throat. So what do you do at home if you get stuck in your throat? Just put a pressure on your tummy. That helps to build the pressure, increase the pressure in your tummy to spit it out. Yeah, it falls out. And obviously, you need to go to the hospital straight away because you need assistance. Eventually, if that doesn't work, you need specialist intervention to get it treated. All right, so cleaning your ears can cause damage to the inner ear. So some people tend to use the sub objects to try and clean the ear or with intention of removing the earwax. So when you are doing your cleaning of your ear, you make sure that you don't take the ear part of thing right into your inner ear. You do it outside, externally, because if you see this diagram, if you get it further here, you have the risk of injuring the inner ear, causing damage to the inner ear, thus affecting the hearing. I am Dr. Ronny Koli. My advice for you is to take care of your ear, nose and throat.